Can vertigo be cured? This answer, yes, and maybe there's more of a gray area. So we're going to get into the details of this question and hopefully help you answer this question for yourself. Welcome to the Vertigo Recovery Channel. I'm Dr. Kevin Smith, and I want to help you not only figure out what's causing your vertigo, but also how to recover from it. Now, this question on whether vertigo can be cured, we got to figure out what's causing it first. So you can check out my video on the 5 most common causes of dizziness, or 5 most common causes of vertigo, as well as my free ebook, and it'll help you figure out what might be causing your vertigo and how to recover from it. So just click the link in my About page or down below, and I hope that is helpful for you. Now, if it's BPPV, 97% of the time, yes. It gets a little bit tricky when there's more than one canal involved, if those little crystals are displaced in more than one canal, or if you have some kind of like a candle jam where you have this what we call atypical BPPV, where it's not presenting as it normally should, or if it's stuck to the cupula at the end of the canal. There is tricky to resolve BPPV, but most of the time it can be resolved. Now, if it's a vestibular neuritis, again, that almost very often you can get back to normal with vestibular exercises and treating all the impairments that come along with it. Same thing with 3PD, where you have this problem with all of your sensory systems are not getting processed as efficiently as they should in the brain. We do exercises to help your brain process that information and prioritize which information it should be prioritizing at any point in time. And cervicogenic dizziness as well, addressing neck impairments and neck proprioceptive issues. Those are all things that can be cured and get you back to normal. Now, things that may not be, you may not be able to cure, but definitely can be managed better. Things like vestibular migraines, Meniere's disease, a lot of those is going to come down to lifestyle factors, figuring out what's triggering your migraines and managing that, as well as what might have come along with the migraines or Meniere's, such as a visual motion sensitivity or imbalance, or any neck problems that you might have on top of it. Maybe you have cervicogenic dizziness along with it, or you have 3PD along with it. So we can definitely manage it better. We can deal with some of those side effects that come along with it and have you feeling better and getting you back where you want to be, whether it's back to working or enjoying your family or your friends or getting back to your sport of choice, either one. You can definitely get better from those. Now, problems like autonomic disorders like POTS, again, you can definitely manage it better. May or may not be cured. A lot of times if it's occurring after a concussion, you will get back to normal. You sometimes have those chronic conditions where it doesn't, but most of the times it does. And then other diagnoses like rare diagnoses like tumors or perilymphatic fistulas or semicircular canal dehiscence that needs surgical intervention. Yes, it can be cured, but you probably need surgery to fix. So that's kind of a rundown of some of the vestibular diagnoses that can be helped, and kind of an idea of what you need to do for some of those that can just be managed better. You may not ever really get rid of that specific diagnosis. Sometimes you do, but you can definitely have a better quality of life. So I hope this was helpful for you, and if you have any questions, please feel free to reach out. Thank you for watching.